Hi, Dr. Dave here, New York City area chiropractor and director of Synergy Wellness, Chiropractic and Physical Therapy in Manhattan, New York. This video goes over 10 herniated disc exercises and stretches for the lumbar region or lower back region. If you've been diagnosed with a disc herniation, disc bulge, spinal stenosis, disc degeneration, even arthritis, these flexibility exercises and strengthening exercises are great. We also have some great videos on the difference between a disc bulge and a disc herniation. Make sure you check that out. Also, we've got a great video on the two different types of stenosis. I actually edit all these videos. I love doing that. I produce, I direct them, I do the lighting, I do the sound, I do the special effects, the after effects, you name it. I actually went to film school, true story, before I went and got my doctorate. I'm not asking for an Academy Award or an Oscar. I'm just asking for a thumbs up. Click that thumb, like this video, and don't forget, most importantly, to subscribe. I appreciate you. Love you guys. Thank you so much. When recovering from a disc injury, herniation, bulge, spinal stenosis, or a pinched nerve, it's important to start with flexibility exercises. So we're going to start with the glute stretch. You'll sit in a chair, one foot flat on the floor. You'll take the opposite foot and place it up on the knee in a figure 4 position. You'll then place gentle pressure on that knee, pushing it down, while bending your upper body forward until you feel a good stretch in your buttock region. Maintain that stretch for about 30 seconds and repeat. Do 3 sets of 30 seconds and relax and do the other side. Need a partner for this one, lumbar traction. With the person lying on his back with his knees bent, get yourself in a kneeling position at his feet, holding them together. Take a belt or a rolled single sheet that's long enough, put it behind his knees and wrap it around your hips, tightly crossing at your back and held by your hands on each side. Slowly move your body backwards until the person feels comfortable holding the traction, and slowly return to the initial position. Hold for about 60 seconds, doing 10 repetitions. The third stretch, stretching your IT band and your piriformis. Sit with a straight back and cross one leg over the other. Hold your knee with the opposite arm and pull your knee across your chest towards the opposite shoulder until you feel a stretch on the outside leg and or buttock. Maintain the position and relax. Hold for about 30 seconds. Do 3 repetitions of 30 seconds and switch to the other side. Flexibility exercise before we get into the strengthening exercises. The hamstring. Lie on the floor in a doorway or close to a corner of a wall. Place one leg up against the wall, the other is straight on the floor, and your buttock is as close as possible to the wall. Extend the elevated leg and pull your toes down towards your face as much as possible until you feel a stretch behind your thigh. Hold the stretch for about 30 seconds. Do 3 sets of 30 seconds and do both legs. Now for the strengthening exercises for those that suffer from disc injuries. We're going to start with passive range of motion extension. Lie on your stomach with hands under your shoulders. Push up with your arms and lift gradually. Your head, then your upper back, all the way up to your lower back, keeping the glutes relaxed and your pelvis against the ground. Push up with your arms. Make sure you're not going too far to cause pain. And make sure you repeat this about 10 repetitions, and you can do 2 sets of 10 repetitions. Passive range of motion extension. This is a variation on the last one. Lie on your stomach with your chin tucked in. Place hands at approximately your shoulder height and bring your leg up in a figure 4 pattern as you see here, while keeping the hips and legs flat on the table or floor. Press trunk upwards with the arms while relaxing your abdominals and your buttocks. Slowly return to neutral position and repeat. Do 10 repetitions, 2 sets. And make sure you do both sides. Press up with hips off center. Place hands at approximately shoulder height and shift your hips and pelvis away from your body to the right side. While keeping the hips and legs flat down on the table or floor, press your trunk upward with your arms while relaxing your abs and your buttocks. Slowly return to the neutral position and repeat 10 times for 2 sets. Make sure you do the other side, the left side, and shift the hips to the left as well. Now for one of my favorite disc herniation exercises, stabilization flexion. Lie on your back with your knees bent and your back in neutral position, slightly arched. Activate your lower abdominals and your transverse abdomini by bringing your belly button inward and by activating your pelvic floor muscles, your inner thigh, about 20 to 30% of maximal contraction. Lift one knee towards your chest and hold it there with your hands. Maintain a steady abdominal breathing while you lift the other foot off the floor, keeping your back and pelvis completely still. Return slowly to initial position by lowering one leg at a time and repeat the entire sequence, beginning with the other leg. For about 2 sets, 10 repetitions, and hold for about 5 seconds. Make sure you do both sides. Another one of my favorite lumbar stabilization exercises to strengthen the low back, the multifidus stabilization. Get on your hands and knees, 4-point position with your knees and hands, hips and shoulders width apart. Your back is in neutral position, slightly arched, and your chin must be tucked in. Activate your lower abdominals, transverse abdomini, by bringing your belly button inward and by activating your pelvic floor muscles, the inner thighs, to about 20 to 30% of maximal contraction. Maintain a steady abdominal breathing while you simultaneously lift one leg backwards and the opposite arm overhead, keeping your back in the neutral position. Return to initial position and repeat with the other leg and arm. Do about 10 repetitions, 2 sets, and hold for about 5 seconds with the arm and leg extended. Make sure to comment below if you have any questions or you'd like to see any videos or specific exercises or conditions covered. Last but not least, strengthening the glutes. Very important. Lie on your back with your knees bent, contract your abdominal muscles and your buttocks while lifting your buttocks off the ground until your trunk is aligned with your legs. Slowly return to the initial position and repeat for 10 repetitions, holding for about 5 seconds at the top, and do 2 to 3 sets. Thanks for tuning in, but hold on. Hit that thumbs up, like this video, please. And don't forget to subscribe. We'll see you guys soon. Thank you.